Okay, let's cut through the awkward silence. What if I told you that one of the most private things a man can do is also a secret weapon against prostate cancer, erectile dysfunction, and even depression in his later years? Today, we're talking about something most men are too embarrassed to even whisper. What really happens to your body if you stop masturbating when you get older? The answers are not just surprising, they're critical for your long-term health. We're going to dive deep into the science, break down the myths, and give you 4 pieces of advice from a urologist that could change how you view your health forever. This isn't about judgment, it's about empowerment, knowledge, and living your longest, healthiest life. The information we're about to share is powerful, and we believe everyone deserves access to it. And if you want to keep getting real, no-nonsense health truths like this, hit that subscribe button right now. Your health journey deserves honest answers. Let's start with a gland you probably don't think about much until it causes trouble. Your prostate. Deep inside you, there's a gland about the size of a walnut, nestled right below your bladder. The prostate. Its main job? To create the fluid that nourishes and transports sperm. But as you age, this tiny gland can become a huge problem. We're talking about conditions like benign prostatic hyperplasia, or BPH, that annoying non-cancerous enlargement that makes you constantly run to the bathroom, gives you a weak stream, and makes you feel like your bladder is never truly empty. Then there's prostatitis, a painful inflammation of the prostate. Sound familiar? Many men face these issues. So, how does something as private as masturbation play a role here? Think of it like this. Your prostate is constantly producing fluid. If that fluid just sits there, stagnant, it's like a pond that never gets refreshed. What happens to a stagnant pond? It gets murky, it collects debris, and it can become a breeding ground for problems. Your prostate is no different. When you ejaculate, that fluid is expelled, essentially flushing the system. It's a natural cleansing mechanism. Without this regular flush, what happens? First, components of that fluid can crystallize over time, forming tiny stone-like blockages. Doctors call them prostatic calculi. These little stones can cause inflammation and even provide hideouts for bacteria, increasing your risk of painful prostatitis. Imagine tiny pebbles forming in your pipes. Not good, right? Regular flushing clears those out before they become an issue. But there's something even more critical. Some significant research suggests that this regular flushing might reduce your risk of prostate cancer. A landmark Harvard study published in European Urology followed nearly 32,000 men for 18 years. And what they found was astounding. Men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. This isn't just a minor blip. It's a powerful correlation. The theory? Regular ejaculation might help clear out old cells and even potential cancer-causing substances that could accumulate in the prostatic fluid. Now let's talk about older men. If you no longer have a sexual partner, or if your partner's libido has changed, masturbation becomes your primary, most reliable method for ensuring this vital protective flushing occurs. It's a proactive, personal step you can take for your long-term prostate health. Neglecting this means allowing stagnation, potentially increasing your risk of inflammation, blockages, and the accumulation of harmful substances. It's a simple, free, and effective preventative health strategy that is too often ignored because of old-fashioned stigmas. Your health is too important for outdated shame. Next up, erectile function. It's a common and completely understandable fear among aging men that their ability to achieve and maintain an erection will decline. While some age-related changes are normal, the principle of use it or lose it is absolutely relevant here. An erection is, fundamentally, a vascular event. It's all about blood flow. When you get aroused, your brain sends signals, causing tiny muscles in 2 sponge-like chambers in your penis to relax. These chambers, called the corpora cavernosa, then fill with blood, making the penis firm and erect. The health of these blood vessels and smooth muscle tissue is absolutely critical. Think of them like balloons. If you never inflate those balloons, they become stiff, brittle, and lose their elasticity over time. Regular erections are like stretching those balloons, keeping them flexible and ready for action. Masturbation and the erections it produces acts as a form of physical therapy, a vascular exercise for your penis. Each erection stretches those smooth muscle tissues, flooding them with oxygen-rich blood. This keeps the tissues pliable, healthy, and responsive. When erections become infrequent, this vital process simply doesn't happen. The tissues can receive less oxygen, a condition known as hypoxia. Over time, this can lead to a loss of elasticity and even scarring of the delicate erectile tissues. This scarring, or fibrosis, makes it progressively harder for the tissues to expand and hold blood, leading to weaker erections or even full-blown erectile dysfunction. So, for an older man, regular self-stimulation isn't just about pleasure. It's about physiological maintenance. It's how you ensure the intricate vascular machinery of your penis stays in good working order. By inducing erections regularly, you are actively fighting against the atrophy and fibrosis that can occur with disuse. This is especially crucial because conditions common with age, like diabetes, high blood pressure, and heart disease, already compromise blood flow throughout the body, including to your penis. Masturbation acts as a targeted workout that directly counteracts some of these effects on a local level, keeping those neural and vascular pathways sharp and active. If you stop this practice entirely, you're not just ceasing a pleasurable activity, you're ceasing a form of preventative maintenance. The delicate tissues can become less pliable, the vascular response can dull, and your ability to achieve a firm erection, even when you desire it, can diminish much more rapidly than it otherwise would. It's an active way to preserve a natural bodily function for as long as possible. Don't let your body forget what it's capable of. Now, let's talk about the profound connection between your sexual health and your mental and hormonal well-being. This connection doesn't vanish with age. In fact, it often becomes even more vital. The act of masturbation, and specifically reaching orgasm, triggers a complex and utterly wonderful cascade of neurochemicals and hormones in your brain. Here's the magic. First, there's a massive release of dopamine. Dopamine is your brain's natural reward and pleasure chemical. It's linked to feelings of motivation, focus, and sheer happiness. That surge of dopamine provides an immediate mood boost and a deep sense of satisfaction. For an older individual who might be grappling with loneliness, the loss of loved ones, or chronic health issues, these moments of pure, neurochemical-driven pleasure can be an incredibly valuable tool for combating low moods and anhedonia, that frustrating inability to feel pleasure. But it doesn't stop there. Orgasm also unleashes a flood of endorphins, your body's natural painkillers and mood elevators. Think runner's high. Endorphins can genuinely help to alleviate those chronic aches and pains that become more common in older age, and they produce a wonderful sense of calm and well-being. Who couldn't use a natural pain reliever and mood boost? And then there's oxytocin, often called the love hormone, or bonding hormone. While it's famous for its role in social connection, oxytocin is also a powerful anti-anxiety agent. It promotes feelings of relaxation, trust, and contentment. Crucially, it's been shown to lower cortisol levels. That's your body's primary stress hormone. Chronically high cortisol is linked to a host of health problems: high blood pressure, a weakened immune system, and even cognitive decline. By regularly stimulating the release of oxytocin, you can actively manage your stress levels, improve your sleep quality. Yes, oxytocin promotes sleep too, and foster a greater sense of emotional balance. So, what happens if you shut down this regular release mechanism? Your body misses out on these consistent, natural mood-boosting and stress-reducing chemical cocktails. This can make you more vulnerable to the negative impacts of stress and may contribute to feelings of anxiety or depression. It's a holistic process where physical pleasure directly translates into improved mental and emotional resilience. This isn't just about feeling good for a moment. It's about building a stronger, more resilient mind and body for the long haul. Finally, let's talk about something incredibly practical and crucial for your daily life and dignity: bladder control. Your pelvic floor is a group of muscles that form a supportive sling at the base of your pelvis. Think of it like a hammock holding up your internal organs, your bladder, bowels, and everything else. These muscles are vital for supporting those organs, contributing to sexual function, and, most importantly, maintaining urinary and fecal continence. Just like any other muscle group, your pelvic floor muscles can weaken over time, especially if they aren't exercised. For men, a weak pelvic floor can lead to embarrassing issues like urinary incontinence, that annoying little leak when you cough, sneeze, or lift something heavy, or post-micturition dribble, that frustrating small amount of urine that leaks after you think you're finished. These issues aren't just an inconvenience, they can severely impact your quality of life, your confidence, and your willingness to engage in social activities. So, what does this have to do with masturbation? The process of sexual arousal, and especially orgasm, involves a series of involuntary, rhythmic contractions of these very pelvic floor muscles. The orgasm itself is essentially an intense, natural workout for these specific muscles. These strong, involuntary contractions are a powerful way to strengthen the muscles responsible for shutting off the flow of urine and maintaining bladder control. Think of it as a natural, built-in Kegel exercise session. While men absolutely can and should learn to do conscious Kegel exercises, the involuntary contractions during orgasm provide a different and often more intense form of muscle engagement. By regularly engaging in this activity, you are consistently toning and strengthening your pelvic floor without even having to consciously think about it. This can directly translate to better bladder control, a stronger urinary stream, and a reduced risk of those embarrassing incontinence issues. Without that workout, the hammock starts to sag. Conversely, if a man becomes completely celibate and stops masturbating, he loses this regular, automatic pelvic floor workout. This lack of stimulation can contribute to the gradual weakening and atrophy of these vital muscles, potentially accelerating the onset or worsening the symptoms of urinary incontinence. It's a classic case of disuse atrophy. For men who have undergone prostate surgery, which can sometimes damage the nerves and muscles related to urinary control, rehabilitating and strengthening the pelvic floor is a key part of recovery. In this context, once cleared by a doctor, resuming sexual activity, including masturbation, can be a beneficial part of that rehabilitation process, helping to regain strength and function in the pelvic floor muscles. It's a functional benefit that goes far beyond the bedroom, impacting your dignity and daily confidence. Look, I get it. This can be an awkward topic, but your health is too important to be sacrificed for a bit of awkwardness. Imagine two 70-year-old men, let's call them Bob and Jim. Bob stopped all sexual activity at 60, believing it was simply over for him. Jim, however, understood the science we just discussed and continued to prioritize his sexual health privately. 10 years later, what might their urologist reports look like? Bob might be battling persistent prostate inflammation, complaining of weaker erections, experiencing mood swings, and dealing with frustrating urinary leaks. Jim, on the other hand, likely reports a healthier prostate, maintains stronger erectile function, enjoys better mood regulation, and has better bladder control. The difference isn't magic, it's consistent, informed self-care. In conclusion, the decision to maintain a healthy, private sexual life through masturbation in older age is not one of mere indulgence, but one of profound self-care and preventative health. We've seen how it serves as a crucial maintenance routine for the prostate, potentially lowering the risk of inflammation and even more serious diseases by regularly flushing the system. We've understood it as a form of targeted vascular exercise, preserving the delicate tissues and blood vessels needed for healthy erectile function, and fighting the use it or lose it principle. We've explored the incredible neurochemical benefits, seeing it as a natural pharmacy that delivers powerful mood boosters like dopamine and endorphins, and stress reducers like oxytocin, which are essential for mental and emotional resilience. And finally, we've recognized it as an effective automatic workout for the pelvic floor muscles, a key factor in maintaining bladder control and dignity in daily life. To neglect this aspect of health is to willingly forego a suite of natural, built-in protective mechanisms. It's about taking ownership of your body and using the tools nature has given you to live a longer, healthier, and more vibrant life. The conversation around aging and sexuality needs to change, and it starts with understanding and embracing this vital science. Thank you so much for joining us for this incredibly important discussion today. If you found this information valuable and believe others should hear it too, please give this video a thumbs up and, most importantly, hit that subscribe button and turn on notifications. We are committed to bringing you more honest, evidence-based content to empower your health journey. We'll see you in the next video.